This is Dr. Sachingupta with a new presentation of a case of fistula and ano. This is a case from Saharanpur with the age of 40 years and a male patient. This patient is having the bit tricky track in the one track in the one track which is lying in the scrotal region, and another one track is going into the anal canal. So it is the same track with a blind external opening, and you can see there is a this fistulogram. Basically there are two views, basically three views. One is AP view, one is lateral view, and another as this branch is going towards urethral parts. So RGU, that is retrograde urethrogram, has been done. So you can see in AP view there is you can see these two films. In this the dye is passed and there is a spillage of dye inside the anal canal. And in this also, this lateral view, you can see there is a spillage of dye which is going into the anal canal, along with it goes towards in the scrotal region. Whereas RGU is very important to wherever the fistula is in the scrotal to, that is penile to scrotal part and scrotal to perineum part, because sometimes some fistulas are attached with the urethra also. So in this RGU, you can see that there is a clear urethra. There is no stricture, there is no branch, and we are now proceeding towards the procedure. Thank you. So the presentation of the case is like this. Like I have already explained in fistulogram. So before proceeding towards this scrotoperineal rectal fistulas, one must be remember that there is catheterization pre-operatively. It is very mandatory because you can feel the catheter inside. Yes, while doing surgery, it is very important. And the extension of the tract. Now you can see there is a external opening at 11 o'clock. Okay, this tract goes towards the anal canal, and there is extension of this tract in the base, at the base of the scrotum. So what I'll plan for this case is I'll create one more external opening here, and I'll put the probe inside. I'll do the coring of the tract like this, and remaining tract which is dealt by the SHAR sutra in the anal canal. And this patient is having also second degree hemorrhoids, and I'll perform Shara karma in that. And with there is external, these are the skin tags basically, and I'll remove by the help of Agni karma. Thank you. See, this is a second degree hemorrhoidal complex, or the hemorrhoidal mass at 3 o'clock. So this is anoderm, this is mucocutaneous junction, this is hemorrhoidal complex, there is a dentate line. So now we'll proceed towards application of Shara karma. This is the application of Shara. You can see the Shara is applied over the hemorrhoidal complex, and basically we have to notice, or we have to take care of three things. That is the mucocutaneous junction, and next is the dentate line. It is having the wonderful effect. You can see the changes in the color of bile mass, that is the necrosis. This is the application of Shara at 7 o'clock hemorrhoidal complex. Within 30 seconds, the bile mass gets necrosed by its natural chemical action without any stricture formation and stenosis. As we see in mucopexy and other treatment modalities like sclerotherapy, IRCP, what are the procedures in other modern sciences? They are having their own complications with stricture formation, anal stenosis, if they are not done in proper plane. This procedure is also having their own complications when it is not performed in a correct plane. Again at 12 o'clock our component, we are going to proceed with Shara karma. Never rub it. Just apply over the hemorrhoidal component. If we start rubbing, there may be chances of oozing from the bile mass. So just apply it. It will do its action. See the action. See the action. There is immediate necrosis within its application. So this is the Sushruta explanation in text, that is Shara Karma in hemorrhoids. So we can state it this fistula as a scrotoperineal anal fistula. You can see with the help of dye test, as the dye is coming from 12 o'clock. So this track is like this. It is moving like this. So it is L-shaped tract. Probing is done in both the tracts. That is in one tract which is going in the anal canal, and from this same external opening, that is extension up to the lower base of the scrotum, we are creating another opening with the help of cautery. Just take out the probe outside like this. Now I'll go for coring. By careful, the main careful step here is don't injure the urethra. So we'll go by a coring method, that is a circumferential incision is taken around the external opening. Do not take wider incision because it will create large wound. पकड़ बेटा, पकड़ो लीडर. So tract is taken out from the base of the scrotum. Do not explore this scrotal sac if it is at the base of scrotum. This is scrotal sac, you can see. Here is the scrotal sac and this tract is attached here. First the attachment is released from the scrotal sac behind, then I'll start the section around the tract. Now I am very nearer to the external opening. You can see this is the external opening. You can see this is the external opening. This is the tract. Main tract is dissected from here. I'll excise hold the tract up to this level and put a SHAR sutra inside the anal canal. So we almost reaches the external opening. Now I am coring the tract circumferentially. I am coring the tract circumferentially. It is a thickened tract and fibrosed one. You can see the mug inside, blackish. This is infected tissue. This is this one. बंद कर देता लो. So tract is taken out from the cavity. It will reduce the treatment duration of SHAR sutra therapy. It is a modified procedure. 3 to 4 centimeter almost 3 to 4 centimeter tract is taken out, which is going inside the anal canal. This will reduce the post-operative, that is the treatment time of, that is the SHAR Sutra therapy. And also this is fast. If we put a simple ceton inside the tract also, it will drain, but it will take the time and the patient is in pain always. So better to do the coring if the tract is fibrosed one and they are lengthier, that is the length of the tract is more than 8 to 9 centimeter also. So lastly, the SHAR Sutras, that is ceton, is inserted inside the anal canal. It is crossing both the sphincters. If we'll do the dissection in the sphincters, it will damage it and there is a chances of incontinence. This thread drains the tract without injuring the sphincter muscles and heals the tract nicely. So this will reduce the time period of the therapy. If we'll put the thread from base of the scrotum, if we put the thread from this side, I'll demonstrate. If we'll put the thread from here to here, then from here to here, it will take almost 3 months for a patient to heal. So this will definitely, I'll put this very small ceton inside. Definitely it will be healed within 1 month. So this will reduce the time period of the patient. It will also reduce the pain as well as injury to the tissues. Now we'll proceed towards the packing of the wound. So next is the packing of the wound. This is a gauze piece, which is sterile gauze piece, which is dipped in Jatyadi Tela. So just pack the wound with the help of gauze piece. This oil reduces the burning sensation of the cautery done to the tract and the adjacent tissues also. And in this cavity also the packing is done. Now next test is the swab test to check the anal canal for any bleeding or any oozing. I am introduced my proctoscope inside. I'll take the plain gauze piece to confirm whether there is any bleeding inside. So you can see the screen. So there is no bleeding inside. You can see the lower folds of the rectum and the Shara karma over the hemorrhoids. You can see here clearly the necrosis of the pile mass inside without any oozing. So now I'll go for packing of the anal canal with the help of gauze piece dipped in Jatyadi Tela.